Good evening, everyone. I will show you the procedure and how to take vital sign. Vital sign is taken in the following indication. First, upon admission of the patient, start of the shift routinely, as the Muse score of the patient, after receiving the patient from an operation procedure during the blood transfusion. Here are the instruments of taking vital sign. I make it sure that it is functional and clean. First, we have three types of digital thermometer. We have the digital thermometer that will check the body temperature orally, axillary, and rectally. We have Temperate thermometer measuring through ears, and infrared thermometer measuring through forehead. We have blood pressure apparatus or sphygmomanometer to check the blood pressure. We have the stethoscope to check the heart rate. We have the glucometer to check the blood sugar level. And we have the pulse oximeter to check the oxygen saturation. We have the pains tool to assess tool in assessment of hand hygiene, hand rub using alcohol-based jelly sanitizer. Introduce yourself to the patient. I'm Vincent Castro. Now, I will perform the taking oral temperate thermometer. Using oral thermometer, position the patient properly. Ensure that the patient has not drunk hot or cold, smoke, chew gum for the past 20 minutes. Ask the patient to open his mouth, raise his tongue, and place the oral probe in the side of the tongue, then close it. Then wait to the beep tone and document the result. Next, we have using rectal thermometer. Position patient properly in same position. Applies lubricant jelly over the probe tip. Expose the anal area. Raise the upper buttock. Insert the probe tip ½ inch in the rectum. Hold the probe in the place. Wait from the beep tone. Remove the probe. Cleanse the thermometer and document the result. Next is the using axillary thermometer. Expose patient axilla, dry with the towel or tissue if this is wet. Place probe in the center of axilla. Place the person arm in the chest. Hold it and wait to the beep tone and document the result. Next, using tympanic thermometer. Cover the thermometer probe with a disposal cover. Position the patient properly. Ear in the front. Position the patient properly in ear in the front. Pull back the ear and gently insert the covered probe. Press the on button. Hold in the place until you hear the beep tone. Release the result and press the eject button and discharge the disposal properly the probe cover and document the result. Next, using infrared thermometer. Place thermometer 2 inches away from the forehead. Then press on the trigger on the button, wait the beep tone, and read the result, and document the result. Okay, next. How to check the pulse rate and respiratory rate. Position patient properly, elbow in 90 degrees, and the hand rests in the table. Using the index and the middle finger, place the finger in the radial pulse. Thumb and press it slightly to feel the pulse, or bring the patient in the chest. Note the pulse, regular rhythm, or weak or strong. Using watch with the second hand, count in 1 full minute and document the result. Checking the respiratory rate. Rest your fingers are still in the place in the patient hand on the chest for the pulse check. Pretend that you are still checking the pulse and observe the rise and fall of the chest. Of the patient chest, note if this is for the depth of the swallow or the rhythm is fast or slow. Count in 1 full minute. Remove the hands from the patient chest and document the result. Now, checking the heart rate. Using the stethoscope, form the diagram on the heart rate, checking over 2 to 3 inches in apical area at the left side under the left nipple. Count in 1 full minute and document the result. Now, number 5 is pain. How to assess pain? If the patient is not complaining of the pain, use VAS or visual analog scale 0/10. If the patient are complaining in pain, assist by the acronym called SPA. C. Called SPA. C is consist character of the pain, example, stabbing or burn. O. Onset of pain, example, pain feel yesterday or other day. L. Location of pain, example, headache in temporal area or in abdominal area. D. Duration of pain, how long the pain, 30 minutes or 1 hour. S. Severity of the pain, use pain stool or scale. P. Pattern of or continuing pain, example, on and off pain. And A is associated sign symptoms, if you have fever or you cannot eat or you cannot do your daily living. Okay. Then document the result. Next, how to check oxygen saturation. Warm the selected finger or the site that you will check SpO2. Start the oximeter by pressing on. Insert or clip the finger on the device. Wait until the result appears and document the result. Next, checking blood pressure. The precaution to be considered before taking blood pressure. Do not take blood pressure on the site of IV infusion, CAS, dialysis access site, breast surgery, injured site, and ask the RN if not sure which arm to use. At least 20 minutes, rest the patient. Okay, first, position the patient properly, arm level on the heart, palm open. Expose the upper arm where the cup you will put. Squeeze the cup if there's an excess air. Close the bulb. Close the bulb. Find the brachial artery. Find the brachial artery by using the index and the middle fingertips. Place the arrow on the cup over the brachial artery. Wrap the cup around upper the arm, at least 1 inch in the elbow. Even this is snugly. Attach the PB up gauge, annual type. Then, place your stethoscope in your neck. Locate the radial pulse. Inflate with the right hand. Inflate with the right hand until the pulse is not felt. Note the reading from the gauge. Place the stethoscope in your ears and the diaphragm in brachial artery. Using the left hand, pressing the diaphragm with the index finger and the middle finger. Inflate the cups 30 mercury millimeter beyond the point where the pulse was last felt. Deflate the cup slowly 2 to 4 seconds by turning the valve screw counterclockwise. Note the point when the first sound is here. This is called the systolic pressure. Continue deflating. Note the point where the sound disappears. This is the diastolic pressure. Remove the stethoscope from the ear. Remove the stethoscope from the ear. Deflates the cup completely. Remove to the patient's arm. Position the patient properly and document the result. Next is checking blood sugar level. Check the expiry date of the strip. How many days are the expiration of the strip upon the opening, and the level 100 days upon the opening. Wear gloves, non-sterile. Non-sterile. Using the lancet holder, remove the cover. Insert the lancet or the needle. Remove the needle cover but don't throw it. Cover the lancet holder. Select the finger. Select the level that you can see in the cover. Then select the finger to be pricked. Clean with the alcohol swab. Open the glucometer. Confirm if the matches is combined. Insert the strip in the glucometer. As indicated in the screen. Now, pull the plunger of the lancet holder and press against the clenched and right finger side. Squeeze tightly the prinkle finger and touch the drop blood with the strip as indicated. Apply light pressure in the puncture finger with a dry gauze or cotton. Turn off the glucometer. Remove the lancet and press release. And use the lancet cover. Then release the lancet and reject the used lancet in the sharp container. Dope the used gloves. Perform the hand hygiene hand rub using alcohol-based gel. Then document the result. Report all result to RN, especially abnormal result, for a proper and immediate management. Thank you, and this is how we take vital signs.